So welcome back guys again, and in this particular session we'll be talking about the Indian healthcare system, and we'll try to understand that how our Indian healthcare system works, because on a such bigger level, we are talking about the India, right? So on a such bigger level, we are actually second highest among the population if we are talking about, right? So at just this much big level, and we need to consider all the community of the population basically. So at this level, how our healthcare system is actually integrated, we'll try to understand about that, right? So on a very first go, we'll try to understand very basic thing about this particular system, that what is the particular structure of the Indian healthcare system, right? What is the foundation of this particular system? Let's talk about that thing, right? So basically, very first point which we are going to talk about, that is, what is the structure of healthcare, right? Structure of healthcare, right? So right now in front of you, you can see this structure of the healthcare. Basically here what we are basically seeing, we are talking about the Indian healthcare system, right? So what we are seeing basically on the very primary level, on the very basic level, right? We are having a primary level, right? We are having this primary, right? I mean the basic foundation which is making, that is the primary level. Then after that we are having having the secondary level, right? And after that we are having the tertiary level, right? So primary level, then secondary level, and tertiary level. Okay, let me give you an example over here. For example, at the very basic thing, right? For example, dispensary. If you take the example of dispensary, let's say, right? So somewhere or other you must have actually visited the dispensary, right? So over there, this is kind of a in the rural areas, right, where at the basic level, right, we should be having something where we are actually able to treat the basic disease, like fever is coming over there, or like chicken pox is coming in the to the doctor or something like that, right? Some small things we should be able to handle them at some lower level, or at some basic level, right? So they should not visit the hospital, or they should not be visiting the bigger hospital, corporate hospital, for such small kind of things, right? So at the rural level, okay, in that rural level, if I'm talking about, right, these kind of people, for an example, these kind of people are not may not be capable of actually paying that much amount of bigger bills to the corporate hospitals and all, right? So obviously to the corporate hospital any kind of patient can go, okay, depending on so many factors. But at the rural level, if I'm talking about, there are the PHCs. These are the primary healthcare centers, right? In the primary healthcare center, usually there is one doctor and there is one pharmacist, and all of these things are there, okay? So it's not a bigger one, but basic things it can actually handle. Now, if some serious case comes, right, the PHC doctor can actually refer this case to the secondary hospital, okay, or I would say the primary healthcare center doctor, okay. This doctor will be referring this case to the secondary, and that will be the community healthcare center. So at the very first level, okay, we are having the primary one, we are having the primary health center, okay. Usually it is funded by the state government. If some more serious case comes, right, this PHC can actually refer the case to the community health center. So it is kind of a bigger level. So community health center, CHC, okay, or some sub-district hospital or the district hospital, these kind of hospitals, they are actually coming under the secondary level, right? So after that, they can actually refer this patient to the community healthcare center. If the community healthcare center is seeing some seriousness of the patient, then they can actually refer this patient further to the sub-district hospital or the district hospital, right? Okay, and then further, there is a tertiary care hospitals. Tertiary care hospitals, where we are talking about, for an example, AIMS Delhi, right, or for an example PGI Chandigarh, okay. So these are, or for example JIPMER, or these are the tertiary healthcare institute, right? They are the bigger level institute where we are having all kind of facilities, right, and from different parts of the country, okay, the people are coming over there, okay, to get the treatment, right? So bigger hospitals, I mean, okay, they are actually tertiary care hospitals, isn't it? So usually you are seeing this happening around, for an example, okay, some of your relative, unfortunately, or some of the other people, right, they are actually getting referred from some small hospital to the bigger hospital, right? They are usually saying, okay, that take this patient to the AIMS, or take this patient to somewhere as some tertiary care institute. That is, tertiary care institute means they will be providing the tertiary care. How they are providing the tertiary care? Because they are having all these facilities over there, right? So that is a bigger thing. So first of all, we are having the primary level, then we are having the secondary level, and then we are having the tertiary care institute, right? I hope you got the idea. So in the tertiary care institute, you are talking about, for example, AIMS, right? These are usually the central government. These are funded by the central government. At the basic level, primary and the secondary level care, okay, they are actually funded by the state government usually, but these bigger institute, tertiary care institute, they are actually funded by usually the central government. I'm talking about the government hospital. Okay, obviously they are private as well. We'll talk about them. So regional cancer institute, regional specialized medical institute, where they can be called as a research institute also, because research is also going on in these hospitals, right? So there could be the medical colleges, all the medical colleges, okay, funded by the government, okay, they are also coming in the tertiary care institute. And the railway, military, ESI hospital, okay, all of these hospitals will be there, considered as the tertiary care institutes, right? So I hope you got this particular structure of the healthcare in your mind, right? Now after that, we shall talk about this PHC, okay? This PHC only, let's talk about some elements of this PHC, right? What is the elements of primary health care, right? So if you talk about the elements of primary health care, these are very important, because sometimes they ask you which of the following is not an element of primary health care. So this can be the MCQ. So for that, we need to understand that what are the types, okay, what are different types of elements of healthcare, right? So let's talk about the elements of PHC, guys, right? So if you talk about the elements of PHC, here we are having, basically you can remember them with the help of elements only, right? So with the E, you can see over here, with the E, there is a education. Education about what? Education about the health problems to the people, right? Okay, this is the work of your primary healthcare, right? So it is working at a very basic level, right? And it is trying to differentiate more serious patient and the more basic patient, right? For an example, the patient is coming up with the cough, right? You will be giving the cough syrup and all some medication, all other medication regarding that, right? And you can actually handle that case at the primary level only, right? There is no need for this patient to send this patient to some other tertiary care institute or some other community healthcare center or district hospital, right? So that's how it is actually trying to differentiate the patients also, right? So basically educating about them. So L for locally endemic disease. Locally endemic disease could be the malaria, could be the typhoid, right? Could be any other disease also, right? So it is the locally endemic disease, means in that particular community, okay, whatever disease cases are coming very regularly or in a very regular period of time, these are the endemic diseases. Actually, that is present from before only, right? So that is the endemic disease. E for, it is the essential drugs, right? It is the essential drugs. M for maternal and the child health care, right? So actually, what are the responsibilities of primary healthcare? So these are the responsibilities, these are the elements of the primary healthcare, right? So these are the functions of the primary healthcare, I can say. So education, locally endemic disease, E for essential drugs, M for maternal and child health, E for expanded immunization, right? All the vaccinations and all which should be provided to the children. And for, there is a proper nutrition, there should be proper nutrition over there. T for appropriate treatment of the common diseases and the injuries, right? S for, there should be the safe water and the basic sanitation measures should be taken over there, right? So these are the actually 8 elements if you talk about the PHC. So question might be coming, which of the following is not an element of the PHC? So these kind of question, to handle these kind of question, you should know all these things. How you can remember this? With the elements only, right? So E for education, L for locally endemic disease, E for essential drugs, and M for maternal and child health care, E for essential drugs and the expanded immunization, and for proper nutrition, T for treatment of some basic diseases, right, and the injuries, and S last for safe water and the sanitation measures, right? So these are the 8 elements of the primary healthcare, right? Once we have talked about that, now let's move on to more important pillars, right? What are the most important pillars as far as our Indian healthcare system is concerned, right? So let's talk about those 4 important pillars. So basically, these are the principles of the primary health care, right? These are the principles of the primary health care, or you can say these are the pillars of the primary health care, right? These are the pillars of the primary health care. 4 pillars are there, okay, and all of them are very, very important. So first one is the equity, right? Second one is the community participation. Third one is the intersectoral coordination, and fourth one is the appropriate technology. So what do I mean by these things, right? For an example, equity. Every patient is having equal right to get the equal treatment. That is the basically termed as this is called as the equity distribution, or it is also called as the equity principle, right? So equity says that healthcare needs to be given more needy people, and every person is having the equal right to get the same treatment, right? So that is the equity over here. So I shall write over here that equity, okay, this color might not be visible to you, so I will write this color, right? So equity, basically it is actually talking about that more needy people, okay, should be getting the health care, right? And should be getting the health care. So should be getting the healthcare and health care, and all people, right, are having the equal rights to get the same treatment, right? Okay, so that is the basic thing. In the community participation, we are actually talking about that, for an example, very basic level, I would say, for example, ASHA workers, right? ASHA workers are actually taking care of so many things at the basic level, right? So okay, that is the community participant. Then how the community is actually participating in this principle of primary healthcare, right? So in the primary healthcare, community is very, very important, right? We know that. And for the betterment of the community, okay, we have actually appointed the ASHA. So ASHA can be actually taken care under that, or the Rogi Kalyan Samiti. We will talk about that further in this particular session only. The Rogi Kalyan Samiti is also taking care of this community participation, right? So then intersectoral coordination should be there. Intersectoral coordination means different kinds of departments are actually coming together. Different kinds of departments are actually coming together for the betterment of the healthcare system, right? So intersectoral coordination says that different sectors are coming together. Different sectors are coming together for the betterment of the healthcare system. Coming together for better healthcare or betterment of the healthcare. Right, guys? For better healthcare. Right? For an example, let me give an example. For example, Ministry of Education is there, Ministry of Health and Family Welfare is there, Integrated Child Development Services are there, right? ICDS, we'll talk about the ICDS also, right? So basically these three systems or multiple systems might be coming together over there, and they might be actually working for the betterment of the healthcare, right? So this is called as the intersectoral coordination. Fourth component, very important, that is the appropriate technology, right? For an example, different kind of apps might be present, might be there from the government side, okay? Or for example, Arogya Setu was released for the COVID-19 patients, right? Or Nikust app for the leprosy, right? So these are the examples of appropriate technology, that with the help of the technology we can actually introduce that in the community for the betterment of the healthcare again. So all of these measures are actually they are actually present over there for the betterment of the Indian healthcare system, right? Okay, so appropriate technology, for example, you are using the technology, very simple, right? For example, Arogya Setu app was released by the government, right? If you guys remember, at one point of time it was mandatory for the people to download it in their mobile phones and or the devices if they are traveling, right? So Arogya Setu for COVID-19, for an example, it could be the example over there, right? For your understanding purpose, Nikust app for the leprosy, and like that there are so many things over there, and this is just the example so that you can understand, right? So now let's talk about the Indian healthcare system on a very basic level. We have already talked about, right? So this is a broader picture, right? Broader picture basically. So this is the bird eye, right? So you are having a bird eye right now, and you are seeing the Indian healthcare system, that how is it working. Okay, so over here on a very broader level, okay, we can actually divide it on two bases, that one is the public sector and one is the private sector, right? So basically over here you can actually see that one could be the public sector and the other one could be the private sector. Okay, depending on, like, more private sector you will be seeing in the urban areas, and in the rural areas obviously the people are actually preferring for the public sector facilities, right? For example, government hospital I'm talking about. So in the public sector there could be the different categories now, right? So if you will actually talk about the public sector, then there could be the Ministry of Health, then there could be the Ministry of Defense for the army people and all, there could be a Ministry of Railways for the railway people, right? And for the private hospitals, obviously we know that there could be some hospitals which are usually private, for working for their own on profit and all, and there could be some non-profit organizations as well, right? There are some hospitals that like some part of it they are getting, some part of fund they might be getting from government, and some part they are actually investing their own money, right? So it's for the betterment of the people, right? So that people might be getting the same level of treatment but at some lower price, right? Okay, for example, charity kind of, or NGOs hospitals, charitable fund hospital, right? These kind of hospitals are coming in the non-profit organizations, right? Okay, so in the public sector, guys, again, if you talk about the Ministry of Health, over here, there could be the state government hospitals and there could be the central government hospitals, right? You might have seen that. So in the state government hospital, we shall talk about that at the level of rural level and at the level of urban level, right? So urban level. So in the rural level, we are usually seeing that there could be the community healthcare center, there could be the primary healthcare center, right? So at a very, very basic level, there could be the social activists. These are the ASHA workers, right? Accredited social activity. These are the ASHA workers. ASHA workers are actually working at the level of village. At the level of village, okay. In the village, we are usually supposing that at the level of village we are talking about the 1,000 population. Okay, so you need to understand that at the level of village, if I'm saying, you need to understand I'm talking about the 1,000 population, 1,000 number of the people living over there in one village. Okay, we are considering that. If I will talk about further in the future, if I will be talking about the block, right, in the block 100 villages are coming, it means 100,000 people are living in that particular block. Block means 100 villages or 100,000 population is present over there. So at the level of village, ASHA is working. Then above that, sub centers are working. Above that, primary healthcare centers are working. Above that, community healthcare centers are working. Above that, sub-district hospital, then district hospital, and then after the district hospital, I told you tertiary care hospitals are working. So over here, this is the category in the rural areas. In the urban areas, if we talk about, there could be some hospital at the taluk level, right? Taluk level, it is also called as the tehsil, right? Taluk is also called as the tehsil. At the tehsil level, some hospitals might be working in the urban area. Then there could be the government medical colleges. Then above that, there could be the district hospital. Then there could be the specialized disease hospitals, for example, particularly cancer hospital or the eye care hospital or the ear, nose, throat hospital. Okay, or this is the ortho hospital only. Okay, these kind of specialized disease hospitals can be there, right? Then super specialty hospitals might also be there, right? Where they are talking about the super specialty things, right? For example, this is the neurology hospital, for an example, right? So this could be the case, or related to the kidney hospital, something like that. Now coming to the Ministry of Defense, in the defense category we shall be talking about the army hospitals, army colleges and army hospitals for the military people. Okay, there are the different army hospitals for them, right? They shall be actually seeking the treatment over there, right? There could be the specialty hospitals over there. There could be the base hospitals and the dispensaries, like for the basic medications and all for the army people, right? Okay, in the Ministry of Railways, we know that for the employees of the railways, they are having different facility from the railways department, from the government, right? There is the dispensaries and there are the specialized railway hospitals also, you know that very well, right? Okay, in the private, we know that for the profit, for an example, there could be the private clinic of the different doctors, right, of different specialities. Nursing homes could be there for again over there, right? Specialty hospitals over there, and the multi-specialty hospitals are there, right? And some of you might be working over there, some of you might be working in the future as well, right? So in the non-profit organization, we are talking about the NGOs, for an example, right? Or some charitable trust hospitals are there, right? So these kind of hospitals are kind of a non-profit organizations, right? Working for the betterment of the healthcare system, right? Working for the betterment of the healthcare of the needy people, so that they can cover those people also who are not able to afford the bigger corporate hospitals, right? So this is the thing. So this is a bird eye of the Indian healthcare system. On the rural level, how it is working. On the urban level, on what levels we are working, right? And there are the private hospitals, there are the government hospitals. The government hospitals also, we are having different things. For example, there could be the railways hospital, different railways hospital. There could be the different army hospital, right? In some cases, there could be the different, like there could be the ESI hospital, right? ESIC hospitals, right? And there could be the on the rural level, we are talking about the primary healthcare, community health centers. Then we are talking about district hospitals, right? In the urban areas, we are talking about the tehsil hospital. Then we are talking about the government medical colleges and the district hospitals and like that, right? So these are the different levels of the healthcare system, right? Once we have talked about that, now let's talk about the healthcare system in itself, right? In the healthcare system, basically, government of India is the top, right? And under that, everything is happening, right? So over here, under the government of India, obviously every state is coming under the India only. So under the government of India, first of all, there is a central government. Under the central government only, other kind of governments are coming, right? Different state governments are coming actually under the central government only, right? So central government is actually will be assessing all the things. So after the state government, they will be actually assessing the divisions, right? Under the division, there could be the districts, right? And under the district, there could be the sub district also, right? And then we are talking about the tehsil or the blocks. Actually, blocks are there, then tehsils could be there, right? And then under the blocks, there might be the villages. How many population, if I'm talking about in the village, how many people I was considering? There are the 1,000 people. So population, if you talk about in the village, there would be the 1,000 population, right? In the block, if I'm talking about how many population I will be considering, I will be talking about 100 villages. 100 villages mean 100 into 100, that will be the, okay. right? So I was talking about the 100 villages over there. Okay, if you talk about the population, they are talking about over there that there could be the 100,000 population, right? So 100,000 population or 1 lakh population, right? Or you can understand, that block level is the bigger level and village level is coming under the block level only, right? So that is the thing over here. Now, in under the district only, there could be the Mahanagar Palika or the municipal corporation, right? Under the district only, there could be the Nagar Palika, and under the district only, there could be the Nagar Panchayat, right? So these are different categories which are actually coming under. Now, if we talk about healthcare system, right? I'm just saying simply that there first of all there are the states. After the states, there are the districts present over there in a very simple language. After the districts, there might be the tehsils, or tehsils are also called as the taluks, right? They are also called as the taluks. Okay. After the tehsils, we are having the blocks, right? We are having the blocks. Okay. And now under the blocks could be for the rural area, the blocks could be for the urban areas, right? So that is the basic thing which we are talking about over here. If we talk about the blocks, right? If we talk about the blocks over here, under the blocks, what things we might talk about, right? Under the blocks, we might be having the towns, right? So now here I am talking about the blocks. Okay. Under the blocks, we are talking about we are having different things over here, right? First of all, let me talk about the towns over here. Okay, different population might be asked. So in the towns, basically we are talking about that 5,000 to 10,000 people might be covered over here. So 5,000 to 10,000 population might be covered under the town level, right? Now if you talk about the board level, right? There could be the board, then there could be the corporation. Okay, there could be the corporation or metropolitan city. As I said, different levels can be there. So I'm just giving you the idea that how many population we are considering under what level. So in the board, in the town, I told you 5,000, 10,000 population. Now if you are coming to the much, little broader level, then after that you are having a board. In the board, we are talking about 10,000 to 2 lakh people, 2 lakh population, right? And if we talk about the corporation, then corporation coming to the much bigger level. So here we are considering that even more than 2 lakh people, even more than 2 lakh population, we are considering under the corporation level. Okay. And then there is a metropolitan city where we are talking about more than 1 crore population, right? In the metropolitan city, we are talking about more than 1 crore population. Okay. So in the blocks, we are having towns. After the towns, we are having boards. After the boards, we are having the corporation. And after the corporation, we are having the metropolitan cities, right? Over there, right? So these are the different population which we are covering. And basically, this is for the urban areas. This is for the urban areas, right? Urban areas. If we talk about the rural areas, urban areas, right? If we talk about the rural area, then what could be the picture? In the rural area, we are talking about the Panchayati Raj system. For example, look over here. This is the tier structure, 3-tier structure of the Panchayati Raj system, right? In the Panchayati Raj system, we are talking about basically 3 levels. One is the village level, one could be the block level, and other one could be the district level, right? In the village level, we are talking about the Gram Panchayat. We are talking about the Gram Panchayat. Okay, in the block level, we are talking about the block samiti, or it is also called as the Janpad Panchayat, or it is also called as the Panchayat Samiti. In the district level, we are talking about the Jila Parishad. Now, if we talk about the Gram Panchayat, it is having again 3 factors over there. One is the Gram Sabha, then there is a Gram Panchayat, and then there is a Nyaya Panchayat, right? So this is the tier structure of the Panchayati Raj system, right? I know who are not very comfortable with the Hindi over here, okay, but these names you need to read over there, right? So I can't do nothing about that. So over here we are having first of all village level, block level, and the district level. In the village level, okay, we are having the Gram Panchayat. Under the Gram Panchayat, we are having other subcategories also. In the block level, we are having the Janpad Panchayat, or we are talking about the Gram Samiti, right? The block Samiti, right? And under the district level, we are talking about the Jila Parishad. Fine. Once we are done with this particular section, okay, now I was talking about the urban area in the block level. Now let me talk about the rural area also. In the rural areas, basically, I told you one very basic thing that in the one village we are talking about 1000 population, right? And in the 100 village we are talking about the 100,000 population. So over here, what I'm saying is that if I will be talking about the urban areas is done, if I talk about the rural area under the block level only, guys, right? Please remember these two rules only, that one village is carrying 1000 population. I told you that earlier as well, right? Because this will be actually simplifying the things further. And one block is actually carrying the 100 villages under it. Okay, in the 100 villages, how many population would be there now? 100 into 1000, that would be becoming your 100,000 population, right? Be very clear with that. Sometimes they ask you ASHA worker, ASHA. I will talk about the ASHA worker in detail, okay, in few moments. Don't worry about that. ASHA worker is actually responsible for how many people or how much population over there. Then you will be talking about that ASHA worker is actually handling one village. She is supposed to handle one village. One village is carrying how many people? They are carrying how many people? They are carrying the 1000 population, right? So 1000 is the number for the one village over there, right? So I hope you are clear now, right? Okay, so that might be the MCQ that might be asked to you, right? Okay, guys. Okay, so please be very clear with that. Now, once again, guys, how our system is actually working. So on a very broad level, we are having the village level. On a very broad level, we are having the village level, right? In the village level, who is working actively? ASHA worker, right? ASHA worker over there, okay? Or there could be some different groups, but ASHA worker you need to remember at least. Then there is a sub center. After the village level, we are having a sub center. I told you that previously also. After the sub center, you are having, primary healthcare center, community healthcare center, then sub district, district hospital, and all of these things, right? So after the sub center, there is a primary healthcare center, PHC. After the PHC, there could be the community healthcare center or CHC, right? After that, district hospital and other things are there. So in the village level, I told you ASHA is working. At the sub center level, I told you need to remember over here that there could be the ANM, which is the auxiliary nurse midwife, and multi-purpose worker. They are actually working under the sub center. That is also your MCQ. Okay, so at the village level, ASHA is working. At the sub center level, there could be the multi-purpose worker and the auxiliary midwifery. Okay, they are the ANM, right? Okay, nurse midwifery. Then at the PSC level, there would be 1 to 2 medical officer, that is the MBBS doctor. 3 staff nurses would be there. 1 lady health could be there, and some volunteers. 1 lady health volunteers could be there, right? So these are the things over there, right? And 4 to 5 SHCs might be there. Now, at the level of community healthcare center, right? We might talk about, the specialist doctors might be there. For an example, there could be the obstetrician present over there, right? Obs-gynae doctor will be present over there. Ophthalmologist will be present over there. Anesthetist will be present over there, right? So these are some doctors specialities. We will be talking about that further also. These kind of specialist doctors will also be present over there in the community healthcare center, right? And they will be actually seeing the patient on the OPD levels, on the OPD basis, right? Okay, and there could be the minor OTs also, where surgeon is present over there as well, and they might be doing some OTs as well, some minor surgery as well. For example, suturing and all of these things. Okay, they might be handled over there at the CHC level only. Okay, fine, guys. So once again, guys, at the village level, we are having 1000 population. At the sub-center level, we are having 5 to 6 villages. So you just need to multiply the 1000 with these 5 to 6 villages. So 5000 to 6000 population they will be carrying. Here they will be carrying the 30,000 to 40,000 population primary healthcare center, and here they are talking about the 1 lakh population because they are talking about the 100 villages. And here you shall talk about that you are talking about block level. Here you are talking about the block level, right? Because block level is carrying the how many villages? 100 villages. I hope you are clear, guys, till now.